What I like about 360 Care is I like to be autonomous. I get to decide the care that I want to give to patients and how to deliver it. I enjoy working with older people. I also enjoy the traveling part of the job, and I really like to, be able to help people that are basically underserved.
You have to look at the big picture with them. You have to look at all their medical conditions. You have to work well with the physicians, with the nurses, and the staff, and typically they're very helpful.
This work is different from private practice in that I go in, I do dentistry, I take care of patients, I provide the care they need, and make their lives better without having to deal with all of the business side of things.
I don't think there's anything more rewarding than what we do. I think you do have to have a limit to the kind of dentistry you think you can do. Obviously, we don't do root canals or crowns, but sometimes just, rounding off a tooth or fixing a broken denture or giving somebody a cleaning that hasn't had one in several years really makes a difference in their lives.
One of the aspects is the autonomy. The fact that we can do any treatment and we're not restricted by an outside entity is wonderful. It gives us complete control over the patient's treatment plan and allows us to provide the quality care that they deserve.
I can look at their health history. I can take a look at their mouth. I can decide, is this somebody that I can, do a certain procedure on or not? If I feel that, they're cooperative enough or we have the expertise to handle the kind of problem they have, that we'll do it. And sometimes we can't, and then we have the option to refer out, which is also a great thing when they have care that we can't handle.
If I decide a patient needs a flexible partial versus a standard partial denture, I can make that decision. I can decide what type denture to make and what types of restorations I'm going to place, and it's overall very good.
Some of the most common procedures I do would be, obviously, number one is that we do exams and cleanings, and then number two, that we do a lot of prosthetic work. So we do a lot of denture work, making dentures and partials, repairing dentures and partials, relining them, adjusting them when people have sore spots and that kind of thing. We also do simple extractions, and then we do fillings from time to time.
I do the standard exams and x-rays and cleanings, and then place restorations, do partial dentures, do dentures, and also do extractions.
We take radiographs with the latest digital radiography that's available. The imaging system that we use is pretty advanced as well, so it allows us to be able to diagnose properly and be able to develop a treatment plan that's proper for that particular patient.
360 Care provides great support in that, they always help me whenever I have a problem. I don't have to worry about paperwork. It's always taken care of for me. If ever I have a challenge with a patient or a home or a social service director, I can always, call the office, and I have great backup people that help me out. They also, are really kind about scheduling me the way I want to be scheduled when I have something come up or, something that would change my schedule otherwise.
When I first started, the things that concerned me was, okay, how is this going to work in the homes? How well will the company take care of me with an assistant and with supplies? And how will I be able to interact with the administrators in different homes? And with a little bit of time doing that, it became very easy to walk into a home, even one that I'd never been in before, and go to work.
I think 360 Care continues to grow because it's just a great, well-run operation. I've worked for another company that does the same kind of service, and I find this company is the best. They have a tremendous amount of support. They have to give you. They have lots and lots of employees that do everything they can to make your job easier. And I've never dealt with anybody that gave me a hard time about anything.
The mission of 360 Care to provide care in these homes fits very well with my values, because I want to provide care for people who need care and want care. And so many of the patients in these homes just have a crying need for care.
I just love elderly people, always have. I have a real connection to veterans because my father was one, so whenever I see a veteran out there, I try to make a special effort to let him know what's going on and what we're going to do and how much we appreciate them.
When I got out of private practice and started working for 360 Care, it allowed me to kind of think a little bit more outside the box as far as treatment goes, and allowed me to treat a greater population of patients. That makes me feel really good that when I go home at night, and allows me to rest easy knowing that I helped someone that day.
Most days are very good days treating patients. I make a difference in their lives. I provide care that they wouldn't get otherwise. And it's really nice when I've given someone back their smile with a set of dentures, or taken care of a problem where they were in pain and gotten them out of pain. It's just a good way to practice dentistry.
If you want to transition away from, the private practice setting, and there are a lot of reasons to do that for some people, I think there's nothing but good reasons to come to 360 Care to do that. I think you get to help an underserved population. You get to feel good about yourself when you come home at night. You don't have nearly the headaches you have when you were working in private practice, and you made a better life for a lot of older people.